Hi, everybody. I'm Johnny Kolasinski, and I'm not a doctor. Jackson Vane is a doctor, but he's probably not your doctor. That means that this podcast is not medical advice. If you need medical advice or medical care, please contact a medical professional. And when you do, please tell them to subscribe to Hi, Everybody, a Bad Medicine podcast.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolasinski. You might remember me from such podcasts as Fix It in Post, the podcast about me not figuring out what fake podcast I'm going to come up with this episode. This is Hi, Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. You can find us on Instagram, Twitter, and Facebook at Hi Everybody MD, and you can find us wherever you're listening to us now, or on Apple Podcasts, Stitcher, Google Podcasts, everywhere fine podcasts are sold.
Yep. So, what are we talking about today, Johnny?
Today we are talking about The Office Season 2, Episode 12. Is it called The Concussion?
No, it's called The Injury.
The Injury, because there are multiple injuries.
Yeah, there's multiple injuries in this one. The Office is definitely one of my favorite shows, and this is one that I've been kind of wanting to do for a little while. Just to set up the premise, Mike calls into the office in a panic saying he got injured really badly. And the way he injured himself was burning his foot onto a George Foreman grill.
We looked this up. George Foreman grills get up to 400 degrees.
Yep.
Did that burn look...
I think the big thing is he wanted to grill bacon so that he can wake up to the smell of bacon. And as a guy who's tried this technique, it doesn't work that well. You get very soggy bacon. You do get a nice smell. My question would be, I know he burned himself on... He says he stepped on the grill and then the grill clamped down onto his foot. But what happened to the grease trap?
Oh, man.
Right?
Yeah, there should have been some splatter.
Yeah, so he should have some splash wounds too, but he has some very nice and neat grill marks on there. And I think one thing that we were talking about earlier is, you get a burn this badly with just very minimal contact? Mm-hmm. And we do see this in the ER quite a bit with young kids grabbing mom's hair iron, like the flattening iron or curling iron, just for a short second, and they come in with a pretty bad burn right away. They start blistering right away. And I think if you look at his foot, you have grill marks, but no real blisters or anything like that. Yeah.
So maybe he's cooking his bacon at too low of a heat?
Yeah, but you can't really adjust. Well, it depends what model, I guess, he had.
Yeah. My theory is that Michael is one of those dorks who would call turkey bacon bacon, and that's why there's no grease splatter.
There's still grease on turkey bacon, though.
That's true.
But it's barely bacon as it is.
Yeah.
And Mike seems like, a classical guy who wants the regular stuff. He wants to wake up to a home-cooked breakfast. Mm-hmm. So why substitute fake bacon with turkey bacon?
That's true. And it's not like Michael's going to watch his cholesterol.
Yeah. But that grease trap, I'm pretty sure if he was in a panic, he stepped on his foot onto the grill, he'd be like flailing around like an animal caught into a bear trap or a fox trap, just flailing and potentially gnawing off his foot, and then grease would be flying everywhere. And you can kind of hear the panic on his voice when he called into the office looking for help. And that moves on to the second injury in this episode with Dwight.
And this is the one that we really wanted to talk about, which is Dwight in a rush to save Michael, because that's in character.
Yeah.
Gets in a car accident.
Yeah, and he's going at full speed, but let me go back. I still want to talk about the foot stuff, but we'll get there in a little bit.
Okay.
But Dwight, in a panic, runs out of the office into his car, and at full speed, you just hear a crash into a pole. And then I was kind of questioning how there were no airbags, but he does drive like a Pontiac, so there was no airbags there. And he gets out really disoriented.
I could also see Dwight being the kind of guy who would actively disable his airbags.
Yes, or not even wear seatbelts, too.
Yeah.
Which, actually, if you watch later in this episode, no one wears seatbelts in this one.
Huh.
And that actually is one of the concerning criterias for how bad your head injury is.
Oh, really?
Were you restrained? Did you go through the windshield or not?
Okay.
He did not, but when he got out, he was actively vomiting, very disoriented, couldn't stand or anything like that. And if we heard something like that come into our ER, we'd activate this probably as a trauma or work him up a little further. But Dwight, being the appropriate assistant to the regional manager at this point in his career, jumps back into his car and drives off. And you can see his car kind of swerving around, which is super crazy and super dangerous at this point.
So as we go through the course of the episode, though, he kind of picks up before he drops back down and is totally out of it.
Yeah, I mean, the thing that you want to consider about him is just his overall behavior. And he does demonstrate symptoms of a concussion as someone, I think the wheelchair man, who is the office building manager, comes in and correctly says, I think he has a concussion. He does display a lot of the symptoms that make me worried that he did have a concussion too. Things like he was listing all of his responsibilities as the assistant to the regional manager while he's fanning Michael's foot with a little tiny electric fan, and then slowly drops his hand down. But he stops mid-sentence. Amnesia is a big part of it, but usually when we think of amnesia in terms of head injury, is it retrograde, which is what happened before, or anterograde, which happened after? So is he forgetting stuff before because of the injury, or is he not making new memories because of the injury?
Okay.
And those are big concerning factors. I think my favorite part was him looking like he's working real hard and he's typing Dwight nonstop on the computer over and over and over again.
Wait, that's abnormal?
I mean, if I was working in an office and I wanted to pretend I was wasting time and stuff like that, I probably would do the same. I don't get an opportunity to do that.
But there's not much downtime. Look busy in a pediatric ER?
Not really. When there is, I'm usually writing notes for my other patients, and I'm not saying Dwight a bunch of times into my microphone over and over again.
Yet.
But I'm sure that'll happen. That felt like that the other night when I was really tired, but not this last shift. Other things, his behavior change is actually one of the big ones. Fans of the show knows he's pretty like straight-laced, kind of a jerk, but he becomes super, super nice to Pam and is giving advice and just being a very gentle, friendly person. And I think that part was a little confusing and concerning for his overall presentation. Like, you're worried that he had a concussion at that point. Things I do tell families when I want them to look out for concussions is he acting like a drunk person? So by that I mean, are you having difficulty walking, which he had? Are you throwing up a bunch? Sure. Are you having mood swings or behavior changes? Yep. So basically, if you're a person who hit their head and now they're acting like they're drunk, that's when I worry.
Okay.
Yep.
So would you see a behavior change like this where he becomes, kinder as opposed to more childish or more...
I mean, normally I see the opposite where they're just really emotionally labile. So they're really sad, really angry, really happy sometimes, but really it's that sad and angry one that you see a lot more, where kids would be difficult to console, or football players would just get really mad and frustrated all of a sudden for no good reason. And that's why that's one of those big concussion symptoms that you always worry about, is like, why are you getting so mad all the time, or why are you getting so aggressive? Could this be related to an acute trauma or chronic trauma that's leading to these concussions? And that's the concerning part too.
So it sounds to me like The Office might be the most accurate medicine we've seen so far.
I would,
at least at this point.
At least at this point. It does get a little crazier later, and also running parallel with Dwight's behavior. It's pretty legit. I think if you want to go back to bad medicine, it's what Michael's doing to his foot to protect it after he burned it on the George Foreman grill. I don't know why he sought the advice of someone who was concussed to protect his foot after he burned it. Because he comes back, right? Dwight drove him back from his house to the office with his foot wrapped in bubble wrap. Not the first thing I would do. I mean, I think Stanley said it best when he said he looked like he was working at mailboxes, etc. I don't think those exist anymore. I think they're UPS stores now, but he looked like he was getting ready to be shipped out somewhere.
So that's obviously step one of burn treatment.
Yes.
Step one of burn treatment, don't wrap it in bubble wrap.
No. You want that baby to breathe. But the other thing you should really do is, initially after a burn, you should run it under cold water. Not ice water, but actually cold water, because ice can actually cause more tissue damage.
Because of the change in temperature?
The acute change in temperature. So running it under the tap with cold water will help. But also the ice is so cold that you might actually kind of cause a little bit of a burn on top of the burn, because your skin is already damaged and compromised, so it's more likely to get more injured. Okay. If that makes sense.
So his step one of wrap it in plastic is a bad choice.
Yes.
His step two of country crock, which is not even real butter.
To be fair, that was not his step two. His step two was having Dwight hold the tiny electric fan over his foot to cool it off.
Oh, okay.
While his foot was still in bubble wrap.
Okay.
That would be wrong on that part.
Would the fan, would the airflow
but
be a good thing?
But there's no airflow because he's in a bubble wrap kind of thing.
Without the bubble wrap, would the airflow be at all effective?
It's not really that effective. You're basically saying, hey, if I burn my foot, or if I burn my hand, I'm going to put it outside of my car window and drive with it. That's essentially what you're doing at the same time. It's not going to do anything. And you also run the risk of someone who's concussed slowly dropping that blade down James Bond style and potentially hurting your foot a little more. But then you go to step 3 with country croc.
Yeah.
You would think that's a really preposterous thing to do. It is not the right thing to do, but this happens a lot.
I've heard that it's an old wives' remedy of you put butter on a burn.
Yep. I mean, you're basting it so it becomes very like flavorful and whatnot, but we also get other types of things put on. So I've seen mustard, mayonnaise, toothpaste is a very common one that people like applying on there because I think the mintiness of it would cause more ventilation.
Yeah, mint is one of the most ventilating of the herbs.
Yes, but there's also all the mints like peppermint, wintergreen, whatever. They all put that on there thinking it works a lot. But it actually does increase the risk of infection, too. So that's the bigger concern is when you put all that stuff on, especially if you have a blister that popped, you're actually increasing the risk of causing more problems. And especially if it's like vinegary based, it's going to burn a lot more, too, because your skin's already sensitive and you don't want to burn it more.
So kimchi and coleslaw are both out?
Yes. Well, coleslaw's more soothing.
Okay.
Yeah. It's cold.
Well, there's vinegar-based coleslaw and then there's mayo-based coleslaw.
Still cooler than kimchi. You don't have that fermenty action that is of kimchi.
I have, in my medical background is WebMD.
Okay.
I've read places that burn creams are generally a bad idea for anything that's blistering as well.
Yeah.
Is that the same reason that it's likely to?
It more covers it over. And honestly, if you came to the ER, as long as the burn doesn't cross any joints or is on your chest significantly, that can affect how you're breathing and whatnot. We sometimes just pop the blister and then apply antibiotic ointment on it and then wrap it in very loose gauze, and that's it.
Okay.
And I kind of get the point, but the gauze actually allows it to breathe. Like plastic you're just trapping in everything in there. The only indication for using some kind of plastic wrap is if the burn is so significant that it completely compromises the entire skin layer, where you're trying to keep moisture in.
Oh, wow.
Yeah.
Okay.
And I've only used that on maybe once, and the only other time I've used it is on like premature babies that don't have fully developed skin yet, and we literally saran wrap babies. Wow. Yeah, you can talk to our NICU friend Courtney about that, but they do put babies in plastic bags with their face still out. They're still
That's
alive.
good. That's good.
Yes. And then he refused any aspirin. Michael, that is, for his pain. I think it's funny that they use aspirin because we don't really use aspirin that much anymore because of its blood thinning stuff. That's why you take it for heart attacks and whatnot, right? But they snuck 4 extra strength aspirins into his pudding like a dog. That's a lot of freaking aspirin. If it was a child, they might get like overdose, like salicylate overdose and have a bunch of other symptoms. Like they'd get ringing in the ears, mental status changes, throwing up a bunch. So I'm surprised. It depends how extra strength these extra strength are and how fast he took it. But there's always a chance he could have had more issues. Then it'll be a really funny episode because then you'll have 2 people vomiting actively at both times with altered mental status.
And then we get into Family Guy.
And then you basically have Family Guy where everyone drank Ipecac, which probably is a future episode too.
I'm sick that day.
You're sick that day? You don't want to talk about massive amounts of vomiting everywhere and if it really works? We don't use Ipecac anymore. It's not good if you want to go on a side talk, but that is no longer a thing that we recommend people to have in their households.
Now, going back to why they used aspirin, from a just logistics standpoint of producing the episode, I wonder if it's simply... Well, in America, we wouldn't know that acetaminophen is Tylenol, and the staff wouldn't, and they didn't want to say, "Oh, I crumbled up 4 Tylenol and stuck in his pudding," and then have somebody do it.
Yeah, and I'm sure it's probably some kind of like advertising logistical kind of thing. Or they just use aspirin as a generic term for any kind of pain
They use aspirin as if we say it's aspirin, we're less likely to get sued because everyone makes aspirin.
Yeah, and that's a lot of... Even regardless of whether or not it's aspirin or Tylenol, that's a crap load of Tylenol too. So his liver would be burned out too. Not quite overdose levels, but he'd start feeling sick with that much. Ibuprofen, that's actually... If he crushed up 4 extra strength, about the right dose, but you still have a little bit of a tummy. But other symptoms, Dwight now is starting to present with more dangerous neurologic symptoms. So passing out is really bad. And then his memory is kind of fading too. And this is kind of leading into when, usually if we see a patient with a head injury acutely, we think about their mental status and we score it based on something we call the Glasgow Coma Score. The GCS is scored out of 15. Usually if your score is below 13 or 12, we start worrying that you have a more than a minor head injury.
Now, does the Glasgow Coma score have anything to do with just soccer riots?
No.
Okay. It's not just your standard Scottish soccer game.
No, unfortunately. This is just about, we score you based on 3 criteria. Your eyes, your voice, and your movement. So each one has like a corresponding thing. So like, if you weren't opening up your eye spontaneously and I had to apply pain to you, you'll get a score of 2 out of 4. And that's already pretty bad because you're now out, instead of a top score of 15, you're down to 13. Mm-hmm. If you ask questions, if you're answering questions appropriately, you get the full score. If you're starting to be very confused when you're talking, like Dwight is, level 4, you got 4 points. If you're very babbly and not making any sense at all, and you have discernible words, you get level 3, or 3 points. So based on just how his presentation is, he probably has like a GCS of maybe 13 or so. Mm-hmm. And that's soon after an injury. You're a little more worried about that one. So it would be less concerning if it had progressed over 8 hours than over 3? It's more concerning if it was more acute, but especially if you start having acute mental status changes. Like usually with GCSs, you don't like get declined. It's usually like quicker kind of changes like that. Like you don't just go from, hey, I'm talking to, hey, I'm no longer moving my eyes and all that stuff, mm-hmm. unless it's like you're herniating. And if you're herniating, which means your brain is swelling so much that it's pushing all the contents down your spinal cord canal area, that's usually bad. Oof. Yeah. We see that when you have really bad head bleeds and whatnot. Mm-hmm. And that's the big thing you want to rule out whenever you hear about someone with a head injury. Is not so much a concussion, because you can't diagnose that with a head CT. You're really looking for head bleeds or skull fractures that are causing pressure onto the brain and then shifting things where they shouldn't be shifting.
I think you and I personally have talked about my stepmom before, who every time she goes to a professional sporting event gets hit by something. Yeah. She got hit by a hockey puck at a work event, and she was doing just fine, except for this was late 90s, and she thought the president was Carter. And then she started referring to her boss as her husband.
So sounds concussion-y.
Yeah.
And usually for the concussions, all you do is kind of just watch them until they progress. Mm-hmm. So if I saw someone who fell 5 feet off of the bleachers at a sporting event, let's stick with that, and they hit their head, and they initially were throwing up a little bit, but otherwise they can tell me who the president is, answer questions correctly, all that stuff, and not having any issues, I don't think we need a CT scan at that point. I'm not worried about head bleed. However, if as we go along he starts getting more tired and listless and difficult to arouse and not answering questions, he's going right through the scanner. Okay. So I think in this case he did progress. Dwight did progress quite a bit. Like he was confused and kind of funny, but then he just drops. Mm-hmm. That would make me really scared. And if I heard that as the doctor, I'd be like, you're going straight through the scanner. And I think it goes to like an old wives' tale where he was walking and then he wanted to take a nap, and mm-hmm. Jim did not want to let him sleep. And everyone thinks that you cannot let a person with a head injury fall asleep because they'll slip into a coma. I'm doing air quotes right now. It's not true.
Really?
Yeah. You do not slip into a coma if you fall asleep with a head injury. That is an old wives' tale. You can totally sleep and it's okay.
Is the risk that you would vomit and aspirate?
No. It's just, they just think that if you had a head injury and you slept, you're donezo.
Okay.
But it's not true at all. Like, I'll have many kids that will show up to the ER and the parents, like 2 a.m, they fell off their bunk bed, hit their head, and the parents like, we kept him awake the whole time, but he's really sleeping. I'm like, yeah, it's 2 a.m. It's okay for him to sleep. We're going to watch. As long as they're breathing normally and not making weird sounds where they're breathing, or they're not throwing up uncontrollably, or they're not weak on one side of their body versus the other, it's okay. You can totally sleep, and that is fine.
So we get to the hospital.
Yeah.
And that's where the episode stops being quite so accurate.
Yeah, it gets real weird real fast.
The only bad medicine comes from the doctors.
And the whole hospital scene. Yeah. He shows up to the ER and they make him fill all this paperwork before he's allowed to do anything. Which is weird because that makes no sense at all. Usually, if you check into the hospital, there's a clerk, but also like a nurse sitting there and asking what brought you in, and they kind of do a cursory, like once over.
You like count your limbs.
Count your limbs. Make sure you're not bleeding profusely. But if you saw someone who was walking up, really stunned, really altered, not answering questions appropriately, reportedly after a car accident where he threw up and it was a high mechanism of an injury, they would not send him into the waiting room and tell him to fill out paperwork before they would send him back. He would be back there pretty quickly being seen by somebody. Or at least into a room where he can be monitored more closely instead of into the wild wasteland that is the emergency room waiting room. That place is nuts. That's why I never try to go out there if I can help it.
Also because you've got the white coat, which means you have a magnet.
Never wear my white coat. Never ever wear my white coat. It just makes me look like a child playing dress up. So I don't wear my white coat to work ever anymore. Plus it's like a germ magnet, and white is the worst color for a doctor's coat.
That's
especially
always
for an ER doctor. It is the worst color. If it was brown, fine. Brown is a great color for an ER coat because it's going to be brown by the end of the day, especially with half the stuff that I deal with on a daily basis. But yeah, he would not be waiting that long.
Okay.
Going back to that part. The other part is the doctor assessed him and said, "You have a concussion. I need a CT scan." Nope.
I think you have a concussion.
Yeah, it's like, I think you have a concussion. It's usually based on symptoms.
Right.
If you said you took a bad head injury, you probably have a concussion, but I'm really worried about something else, then you probably would get a CT scan.
For example, the hernia that you were talking about.
Yeah, herniation. But usually with herniation, you're not breathing really well. The reason why doctors check your pupils is to see how brisk they are, but also if they're equal. So if you have one pupil that's gigantic and the other one that's small, you're really worried that something bad's going on.
So I could totally, having a glass eye, I could totally screw with doctors if they thought I had a concussion.
Definitely. Especially if I have you follow my finger kind of thing.
And only one is following.
And only one is following, like, do you have a fake eye? Because the light is shining really weird and it's not reactive. But you can definitely fool, like, if you came in with a car accident and I didn't know any of that stuff, I'd be like, crap. We need a scan now. Especially if you had trauma around your fake eye. Like if you had bruising around it or if it felt puffy, I'd be super freaked out. No joke. If no one else was there to give me a history. Going back to the CTs, though, we do rules to try to prevent doing CTs. There's different rules for kids and different rules for adults.
Why do you want to prevent them?
Because CTs are a lot of radiation.
Okay, and it's going at your head.
You're going at your head. But not just your head. You have your thyroid right there. And X-rays, granted, CT scans, they're pretty directed. It doesn't mean it doesn't shoot off in other directions too. So it could get into your ovaries or your testicles, organs that grow fast. You're at a higher risk for some type of like malignancy every CT you get. So if we can reduce the number of CTs that we can do on you, we try to. And it kind of classifies with like what your risk is. Like if you're medium risk, like let's say you just had amnesia or a dangerous mechanism, I'd be more worried there. And that actually gets you a head CT. Like you're wondering, well, that's just medium risk. What do I do if it's something worse? Like they're vomiting a bunch. They're old people who are on blood thinners and whatnot. Those usually get neurosurgery consults right away.
Oh wow!
Yeah, so they might go.
So you skip straight to trephining.
Not so much trephination, but get neurosurgery right there to evaluate right away to see if they're stable enough to go to the CT scanner.
I was attempting a joke, and apparently trephination is still a thing.
Oh yeah. Burr holes. Burr holes are a thing.
So trephination is where you drill a hole in the skull to let the pressure out.
Yep.
Oh, wow.
We do burr holes sometimes. Not in the ER, but unless they're really decompensating and the neurosurgeon's there. I've only seen one in my life. It was during a trauma and the patient was like decompensating quickly. We intubated the patient. Neurosurgeon's like, we need burr holes because they're herniating right now. And they're like, the OR is taking too long. I mean,
my goodness.
Yeah. I mean, it's ridiculous, crazy stuff like that. That's how the emergency department works sometimes. Wow. But now I lost my train of thought.
So you were talking about you would go straight to a neurosurgery consult rather than CT scan.
Yeah. At least have them on standby. Like the last place you want to run a code is the CT scanner because
you can't get at them.
You can't get at them, but also it's really cramped, and you can't really push in the code cart with all your medications and whatnot. Doing compressions there is tough. Putting in an advanced airway, like putting a breathing tube, is really, really hard because you need to be at the head of the bed. And unfortunately, the head of the patient is usually surrounded by a giant donut. And that donut is where the CT scanner is. And it's really hard to weasel in there and get a good view to put the breathing tube in. So you want to make sure the patient's stable and okay to make it in the CT scanner. Which the CT scanner is great from imaging heads, trunks, sometimes lower extremities if they have like blood clots or bad fractures. Not so much George Foreman grills.
Okay. What's the difference between a CT scanner and an MRI?
So CT scans are, think of it like a mega X-ray. Okay. You're shooting X-ray beams in different angles, and then the computer calculates all of it and then makes like a reconstruction of it. MRIs as magnetic resonance, so there's no radiation. It causes your protons to spin, and it calculates how fast it's spinning, and then from that it makes an image.
Okay.
So it's a huge difference between the two. And it was kind of weird why the nurse would not let anyone into the CT scanner area with metal. Because no one cares.
Yeah, that was I mean, maybe they've just got the 2-for-1 deal where they just use the same machine for both, which isn't real. No. I'm not that dumb, guys.
But yeah, they brought him. They made Michael leave his crutches outside and would not
take off his microphone.
Take off his microphone. No camera crew was allowed, but they were allowed to stand outside and kind of tape him
and still pick up sound.
Yeah, and it's really against protocol to have someone who's not like a parent. Like if it's like a 3-year-old who's getting a CT scan, the parent's usually in the room, or we try to put them away because it's so much radiation, like we mentioned, that you don't want them anywhere near all of that stuff. So if he was going to be in there, he should be fully leaded up, wearing the lead vest, having a neck shield to prevent it,
to keep it off his thyroid,
and all that stuff too. But then he tried to sneak his foot in, which it does nothing at all.
Is there like a season 7 episode where Michael gets foot cancer?
No, he leaves. He
leaves like season 5, 7. Okay. Oh yeah, because there's 9 seasons.
Yeah. So he leaves at mid season 7, and then the other weird part too was how they made him inhale for a head CT. There's really nothing that would benefit you from inhaling, because usually if you inhale, your lungs get bigger, so you can actually get a better image. I don't know why they made him inhale. So that's just weird protocol for him on that part.
That's really interesting.
I mean, it does sound very
it's
technical.
uber specific.
Yeah, it's uber specific, but it also sounds really technical, right? Like, oh, you're about to go through a CT scanner. Better hold your breath.
Right.
So that we can get a perfect image. It doesn't really do much. We just say, okay, lie still, don't move. Good luck if you try to tell that to a kid. But usually just go, okay, I want you to lie really still. You're going to go through the scanner. Just wait, count to 10 in your head, then you're back out. But then I don't know how he snuck his foot in. That's just amazing. I've had situations where we would use something similar, or a similar situation where I had something we call a fluoroscopy, where if we're trying to set bones back into place, think of it like a live x-ray, that we are using that to see if the bone's getting better or not. And I had one mom straight up go like, I hurt my hand like a week ago. I need x-rays. I'm like, you need to check in if you want me to be evaluated as a patient. I can't just like give you...
There's no family plan.
There's no family plan. There's no 2-for-1. There's no buy one, get one free kind of situation, because there's so much liability. But her kid did break his arm. So we're doing the sedation, and then the mom just tries to sneak her hand into the x-ray machine. But here's the thing. If you don't keep it still, because it's a live x-ray, it's really fuzzy. So we're looking at the bone. We have a nice view, and then all of a sudden I just see fingers moving into it. I'm like, ma'am, you cannot put your fingers into the x-ray. And she's like, but can't you just make sure it's not broken? I'm like, you're moving too much. And it's like, can I just put it flat on the part and just, you can look? And I go, no, you gotta check in if you want me to do it so I can get better pictures. And it turned into this huge ordeal to the point where I had to kick the mom out of the room.
Wow.
And she got really close. Like, I think at one point where we already casted the kid, or trying to get like one more look before we mold the cast. Because contrary to belief, a good cast is actually a relatively lumpy cast, because you're pinching the plaster or the fiberglass to hold the bone in place. So we wanted to look at it one more time before we really apply a good mold. So we get a nice picture, and again, mom tries to sneak her hand in one more time.
So if you get take one lesson from this episode, it's don't photobomb your kids' x-rays.
Seriously, that's essentially what she did. She x-ray bombed her kid's x-ray.
Everything about that is dumb.
Yeah. She didn't want to wear the lead, and I'm like, gotta wear the lead. I know the amount of radiation is about as much as a transatlantic flight, but you gotta wear the lead.
Especially if you're going to make them take 4 more x-rays. Well, I guess it was one long x-ray.
It's all very long x-ray, yeah. And then my favorite part was when we were saving images, because usually we save images. We're saving one, it looked really good, but you can see like projections of fingers going towards the arm part.
Once again, I'm just picturing this is a Family Guy scene. It's not one that's existed as far as I know, but it should.
Yeah.
Seth MacFarlane, call us.
Yeah. It doesn't happen at my current hospital, but it definitely happened a lot when we would have parents in the room while we're doing reductions, and that mom just really, really wanted me to get a picture of it. And all I could think of was this episode of The Office where someone was just trying to get a free picture in there.
So it sounds to me like, except for the actual medical technology, this has been the most correct episode or thing we've discussed.
I'd say it's mostly correct, yeah. A lot of the symptoms with the concussions are pretty accurate. I think when it kind of went south too was after he passed out, he also said like it smells like chicken soup. Mm-hmm. And usually if I hear that, I joke about it, but I go, I think you're having a stroke. And
the weird smells
and whatnot. And that can still be a presentation after a head injury, because if you had an AVM, like an arteriovenous malformation, where your blood vessels are very fragile because they're connected wrong, you can rupture it and can get a stroke and have some of these symptoms too. But again, he'd be a lot sicker. He'd be like on the ground and pretty dead. Mm-hmm. So that would be the concerning part. But the ER scene, that part made me just kind of a little weirded out. I'm trying to think like the protocol at my hospital, but usually they don't fill out any paperwork until they're in the room.
Really?
Yeah. Like they check in, we get basic stuff like your name, your birthday,
why you're here,
what
brought you here.
Yeah. Police car, all the things. And you try to make sure that they're fine before you send them back into the waiting room and make them wait. And most of the nitty gritty stuff like insurance, where you live, what pharmacy you want, is done before you go home, because I don't care about that stuff. Let's be honest.
If you're in there, it's hopefully an emergency.
I can only hope. We can do one whole talk about what's an emergency and what's not until the cows come home, because that is a daily talk that I have all the time. But definitely, if you do have an emergency, you should be seen pretty quickly. And I think the way Dwight was presenting, I'd be much more worried. Mm-hmm. He was scary. I mean, that kind of head injury was a little concerning to me, so I probably would have worked him up a little more. I mean, he called Creed his dad. Creed, the guy who was in an iron lung when he was a kid, he called him dad. That's when should have been the tip-off that something ain't right.
Well, it ties into my stepmom.
What?
And calling her boss her husband.
Who was in an iron lung?
No, but not at the time.
But yeah. I mean, overall, I think it's a really good episode. Still one of my favorite shows. There's many other ridiculous scenes in this whole series about medical stuff. Like the CPR episode's great too, which we'll probably touch on at some point as well. But surprisingly, better medicine in this than medical shows.
Yeah.
Except for,
if you notice, we've not covered medical shows yet because they're too easy.
But it's coming.
Yeah.
There's requests for it. There's many requests. And I think that was one of the 2 medical shows we did at our Comic-Con panel,
Grey's Anatomy
and The Resident, were the ones that got the most like visceral reactions from the crowd.
Yeah.
Like audible, more groans than Uma Thurman getting a needle into her chest. So at some point we will probably be doing medical shows mixed in with all this stuff, because it's low-hanging fruit, but man, that fruit is juicy and ripe for picking. So yeah.
All right. Anything else we want to add on the injury from The Office?
Please don't wrap your foot in bubble wrap.
Yeah.
And if you have a burn, just run cold water, let it breathe. Don't apply it. Less is more. Don't apply anything there. And if you're really worried and you're in pain, it's okay to take medicine. You don't have to run to the ER right away after a burn on your foot or anywhere unless it's affecting motion. So if you can control your pain at home, sometimes it's better to stay at home instead of going straight to the ER. Now, granted, not medical advice, because we're not trying to give medical advice here.
Yeah.
Use your judgment. If you're scared, that's what we're here for. But if I can save you an ER visit and it's safe, give it a shot.
All right. So thanks everybody for listening. If you can, do us a favor, tell some people about the show.
Yep.
We've had a lot of great new listeners coming over the past couple weeks and want to keep that going.
Yep. And if you have any ideas for future episodes, or if there's any corrections or anything that I am completely wrong about, please let us know. We'll probably go back and do like a corrections episode at some point in the future too, because there's so much stuff about medicine. It's an art, not a science, or it's an art and a science. No one's ever perfect at this.
We'll do Hi Everybody, a Bad Medicine podcast about Hi Everybody, a Bad Medicine podcast.
I look forward to that episode. Like, I think Greg Winter's dad did correct him on something already too, and he showed it to us. I'm like, God, it's already happening. But that's okay, because he's the smarter Winter, according to Greg. Hi, Greg.
And hi, Greg's dad.
Yeah.
So, thanks, folks, for listening. We'll be back next Tuesday with more Hi Everybody.
Cool. Thank you so much.
Bye, folks.